Good day and welcome to this episode of Newsmakers, where we bring in people in the news who are making news in order to help you stay informed, involved, and in touch with what's going on in your community. It's my pleasure to welcome into our studio Katrina Harwood, who is the Rock County Public Health Officer. Katrina, welcome.
Thank you very much for having me.
It's great to have you here. And we could start at so many different levels. I know right now we're going through a period of time where the air quality is a big issue due to the fires in Canada, and it seems like that's an annual event that we're just going to have to put up with, correct?
Well, we'll see. I think it'll continue to impact us in different ways. But yeah, any given day there's a different public health topic that is emerging. One day it's air quality, the other day it's some other hazard.
As you and I have talked off and on for many different times, one of my biggest concerns as we look at public health issues happens to be the fact that we place such a small priority on public health in relation to the big scheme of life as we know it. I would have thought that post the COVID-19 pandemic, we would have had a bit of forethought and maintained at least some of the resources and investment in our public health infrastructure that we had to build up for that event, and now it's disappeared. Why is it that we can't keep public health issues in the public eye and make them the priority that you and I both believe they should be?
Yeah, I think that's multifaceted for sure. One thing that I think about a lot in public health and how we communicate about public health is when you say the word health, most people think about their individual health, and they think about how they maintain their individual health going to their provider. So oftentimes when the public hears the word health, they think health care, which is important and necessary, but we don't necessarily have the mindset as a society to think about health as in prevention and what we can collectively do in order to improve not just our own individual health outcomes, but the health outcomes of the community in which we live. Because so much of our own individual health is influenced by the environment that we live in. For example, we were talking about biking. And if you live in a community where there's opportunities for active transportation, biking, walking, well, you're more likely to partake in those activities, and so you get more activity in throughout the day. So I think it's a perception that when we say health, people think healthcare rather than public health and prevention. And then also, we in public health, we need to be better at telling our story.
And you need outlets. You need outlets to tell that story.
Yes, which is why I'm really excited to be here today.
Well, and I'm excited to have you because I do try and stay current on public health issues, and it's an interest of mine that goes back a long time. I read a Centers for Disease Control study. That's light reading for most folks. I actually read this study. It was released last fall, and it's finally getting some prominence and play within the news media, but it had some distressing statistics, at least from my perspective, that caused me to be alarmed. Vaccination rates,
Yes.
particularly as we measure them for compliance and health purposes, we target school-age children as being that point of entrance into the system where they're either vaccinated or not vaccinated, and that provides a bit of a barrier for infectious diseases, and serious infectious diseases at that.
Absolutely.
You've seen the same numbers as I have. We're facing a situation where not only is Wisconsin's ranking among our 50 states near the bottom, but we're really close to the bottom.
Yes.
Why is that? And give us some specifics. Let's talk about measles and measles, mumps, and rubella vaccinations, for example.
Yeah. Well, I will also share that another metric that Wisconsin ranks very low in statewide is funding for public health. We're second to the bottom, actually tied at the bottom for funding with public health. So it's no surprise that we kind of see an association between funding and that state investment in prevention and public health services and some of the outcomes in vaccine uptake, for example. I will say that the situation with vaccines and vaccination status in Rock County children is definitely nuanced. So there's a lot of data points that we can talk about. Kind of in general, when we look at vaccine uptake and vaccination status, we have that kindergarten entry, as you mentioned, and we also have our 2-year-old vaccination rates that we track. And our 2-year-old vaccination rates are looking pretty good. We saw some decreases during COVID, and that was largely due to what we believe were challenges getting into providers to receive those vaccines. We've since seen an increase in our vaccination rates, both among 2-year-olds and among school-age children for certain vaccines, not for all vaccines, for certain vaccines. And so we're encouraged by that. The large majority of Rock County families continue to get their children vaccinated on time or near on time. But
and that's the big but.
Yes.
That's the big but.
Yes, but we do have significant opportunities for improvement.
If you were to use a metric, and I won't casually throw the numbers out, there is a point where the vaccination saturation rate is such that you achieve something, in layman's terms, herd immunity.
Yes.
And nationally, we're not there with measles, for example, and
Correct.
we're beginning to see measles outbreaks across the country. We're not at that point of herd immunity, and in Wisconsin, our statistics there tell us that we're below the national average on measles vaccinations, and this is a disease that we've had pretty well under control for a long period of time. What's changed in the environment?
So I think, there are some things that have changed. Just wanted to provide some of those data points, though. So for children 2 years of age, for the MMR vaccine, 83.6% completed the MMR vaccine, which is one dose at that age, in 2024, which was up from 80% in 2022. That big but and the however, although that level of vaccination is slightly higher than the state average, it's still lower than what we would like to see for herd immunity, which for measles, it's a highly infectious airborne disease that can lead to very serious complications among children, including death. What we'd like to see to have that herd immunity or that community level protection is 95% vaccination rate. So we do have some opportunity there with 2-year-olds and then also with children when they enter kindergarten. So kind of why do we have these lower than ideal vaccination rates? And again, it's multifaceted. There's a variety of contributing factors. One of which is, I think, as humans, we are really good at remembering things that happened yesterday. We aren't very good at remembering things that happened a year ago, 10 years ago, 50 years ago. And especially those of us who weren't here 50 years ago. So I think that's one of the struggles that we have with vaccination. Vaccination remains the most effective strategy we have to preventing communicable disease. But measles, for example, we are decades and generations removed from times when measles was spread very readily, before we had a vaccine that was effective against protecting against measles. And so I think a lot of people have kind of forgotten that this is a serious illness.
And it can be a deadly illness.
Can be very deadly. Yes. So I think, why are our MMR vaccination rates among children so low? One is that recency bias. It's just kind of longer back in history. I think another challenge is that, some families, experience different barriers in obtaining the vaccines than others do. Sometimes with, if people have a regularly established pediatrician or physician, that they go to regularly, they can get those vaccines there. But some people who maybe, move often, or they're just experiencing other barriers, they might be less likely to go in for those vaccinations.
We also have, as a public policy, adopted exemptions for people of school age. There used to be a mandatory requirement that you had your vaccinations up to date as you entered into school.
Yes.
And now you can, for a variety of reasons, get an exception to that. Are we seeing more and more people exercising that option? Is that part of the challenge?
I do think that's part of the challenge, but that is not necessarily the full challenge. So there are opportunities in Wisconsin to have, waivers in place. There's opportunities to do a waiver for religious purposes, medical exemption, because some children aren't able to get the MMR vaccine. And then Wisconsin is one of the states that has what is called a personal conviction waiver. And so essentially any parent can sign that waiver, which kind of relieves that child from needing vaccines when they go to school.
I don't believe in vaccinations, so therefore I can sign a waiver that says my child doesn't have to be vaccinated.
Correct.
And part of that, I'm going to go back to the beginning premise that we laid out, and that's a lack of support for public health education. And because we don't have the resources to do the education, we're beginning to see the result in vaccination rates is one example of where we've fallen down. It's that how public policy can dramatically impact people's lives and qualities of life. And it's not that we're waiting on another pandemic. God forbid we have that episode again.
No one wants that.
These are preventable diseases that in some instances are deadly and can be crippling.
Yes.
In the few minutes we have left, is there one particular plea that you would make to the public as it relates to vaccinations that kind of encapsulate best practice and what we ought to be doing?
I think just being open to having conversation with people. Back during COVID, which no one wants to go back to what things were like during that peak COVID response, I recall being asked by one of our community partners, the vaccine was rolling out for COVID, and they asked, well, what is your elevator pitch for getting people to accept the vaccine? And there is no elevator pitch oftentimes. So I guess the call to action for people would be to have conversation with family and friends if you find out that they have questions about vaccines, which is understandable. I think sometimes we say that people are vaccine resistant when really they aren't. They just have questions and they want to have conversation to understand.
In so many instances, it comes down to the ability to communicate and communicate the options that we have. This is one of them, and I thank you, Katrina Harwood, Public Health Officer for Rock County, for coming in and sharing your thoughts, your concerns, and thank you for all you do.
Yeah, thank you so much for having me.
It's always a pleasure. That's another one of our newsmakers and if there's a message that comes from this particular program, pay attention to your health. It's critical. It is not only important to you personally, it's important to everyone around you. It starts with you. You can make a difference in your community. Until next time, enjoy your day.